Hey guys, Dr. Christine Vaccaro, urogynecologist and sexual medicine specialist in the DC area, here to talk to you today about overactive bladder. This is a very common condition affecting up to 15% of women across all ages. And in that midlife to more mature woman in menopause, that's up to 50%. So an astronomical amount of women that are dealing with these symptoms, which include urinary urgency, so that urge more frequently to urinate, going to the bathroom more frequently, so more than 7 times during the day and more than 1 time at night. That is considered the upper limit of normal, and more than that is considered too frequent. Getting up a lot to go to the bathroom at night is also very disruptive to your sleep, which is not fun at all. Other symptoms include incomplete bladder emptying, so feeling like even if you just went, that you feel like you still could go more. That's that sensation of incomplete emptying. And then probably the worst, most bothersome symptom, which is urinary leakage associated with an urge. So feeling like you have to go, trying to get to the bathroom, trying to get your pants down and you can't quite make it, or trying to get out of your car and getting into your house, things like that. And toilet mapping, meaning you kind of know where every toilet is in the area. Those are symptoms associated with overactive bladder. The good news is you do not have to suffer. There's lots of ways to treat this. The first thing that I like to talk to my patients about is things they have in their control. So dietary changes. So anything that is acidic is going to be irritating to the bladder. The bladder does not like acidity. So things that are very high in acid include, sorry to say, coffee and citrus acid fruit juices. So things like orange juice, lemon, lime, grapefruit, and also other fruit juices like cranberry juice. Now, cranberry itself is great for prevention of UTIs in some patients, but it is not great for patients that have a sensitive bladder, meaning overactive bladder. This can actually make bladder symptoms worse. So try to avoid cranberry juice if you have overactive bladder. Behavioral changes, these are kind of hard because we get kind of stuck in our ways, but just so you know, there's no great evidence to get 64 ounces of fluid a day. This was kind of discussed in 2004 with Institutes of Medicine putting out a statement that basically most adults meet their hydration needs by letting thirst be their guide. So this is just a public service announcement that listen to your body, sleep when you're tired, eat when you're hungry, drink when you're thirsty, unless you've been told by a medical provider that you need to drink more water. Generally, most women and people in general can allow thirst to be their guide. So fruits and vegetables have a lot of fluid content, soups, etc. So a lot of times you don't need to meet a certain goal threshold. Remember, what goes in must come out. So if you're overhydrating, you're just going to be in the bathroom more frequently, and that can be very bothersome. Next is partnering with a really good pelvic floor physical therapist. These providers are magicians for the pelvic floor. They teach you how to use your pelvic floor correctly, which we're not taught about. They'll show you all sorts of things about your pelvic floor, which is this whole muscle group here that I'm showing in the pelvis that works to support our pelvic organs. They'll teach you how to use your pelvic floor properly, teach you techniques like freezing and squeezing to delay urination, teaching you things like mind over bladder to delay urination, and work with you to strengthen your pelvic floor, which are the Kegel muscles. Sometimes providers will also talk to you about other home devices. This one is called the Leva, L-E-V-A, that can be paired with your phone to get you on a program of home exercise therapy for your pelvic floor. So those are things that you can do and reach out to providers in your area for. Next, local vaginal hormones. If you are in that menopause transition or are postmenopausal, vaginal hormones are essential for this condition. I like to start usually with estradiol vaginal cream. And the nice thing is it reduces urinary urgency, but it also prevents and protects you against UTIs, and also reduces vaginal dryness, which can be a source of pain with sex. So bonus, vaginal estrogen is a wonderful place to start when you have urgency. Next is bladder relaxing medications. So there's been some caution about certain categories called anticholinergics, and the very specific name of that is antimuscarinic medication. These can cause side effects like dry eyes, dry mouth, constipation, and potential cognitive decline. So certainly not what I like to start my patients on if I can avoid it. There are other medications though to relax the bladder that don't have those side effects. Those are called beta-3 agonists. Those are like mirabegron and vibegron and are a much safer category of medication. I also perform advanced therapies for overactive bladder when other things are not working. So advanced therapies, once we've exhausted conservative options, include bladder Botox and nerve stimulation. Bladder Botox is FDA approved to treat overactive bladder and urgency leakage. It's usually performed in the office with local numbing jelly, though it can be performed in an outpatient surgery setting. Generally, women get 6 to 9 months worth of relief, but when the Botox wears off, it does need to be repeated. So most women get that done 1 or twice a year to reduce leakage, and it is one of the best treatments we have to maintain dryness. So next is nerve stimulation. So stimulation of these nerves that go to the bladder help modulate or kind of reset the nerves back to normal functioning so they're not squeezing too much. There are 2 ways to achieve stimulation of the bladder. One is through stimulation of the tibial nerve, which is near the ankle, and the other is to stimulate the sacral nerve. And there's 2 ways that we can do that. One is in an office setting and one is in an outpatient surgery setting. What you need to know about overactive bladder is that you do not need to suffer with these symptoms or urinary leakage. And please discuss these symptoms with your primary care doctor, gynecologist, urologist, or the best, which is urogynecologist, which subspecialize in treatment of these quality life conditions.